So good afternoon. I am Dr. Alan Bonda. I'm one of the associate editors of Clinical Liver Disease, and I do have the pleasure today to interview Dr. José María Remes-Troche from Mexico, specifically from the Universidad of Veracruz, who is going to talk to us about his most recent paper published in our journal about the liver and COVID-19 in Mexico. So Dr. Remes, thank you so much for this interview. And I would like to ask you, and then to start, to see what did you think, what will the difference based on your paper with the rates of abnormal liver chemistries within people within the US and in your institution in Mexico?
Thanks. First of all, I would like to thank Clinical Liver Disease and Dr. Bonder, the associate editor of this section. And in our experience, and that is something that is in our paper. This paper is focused on about liver abnormalities in Mexican patients after COVID-19 disease. When we review what was the profile of Mexican patients with COVID-19, we found that we have a high prevalence of metabolic associated liver diseases. As you probably know, Mexico is one of the top countries that has a high incidence of diabetes, obesity, and metabolic associated liver diseases. So when we start our review and we compare our data with previous data from Asia, Europe, and North America, we found a high prevalence of MAFLD and also an advanced stage of fibrosis among COVID-19 patients. Of course, this is also associated with a high mortality compared with what's going on in USA.
So did you find any difference between the cohort of patients that you were seeing in your hospital with any underlying liver disease compared to someone who actually in the US? So whether there's any difference in mortality or more incidence of any complications from a liver perspective in patients who had COVID in Mexico?
Yeah, well, first of all, besides the liver condition associated to COVID-19 in Mexico, as you know, Mexico is one of the countries that has the higher mortality associated to COVID-19. Our mortality rate ranges between 10 to 15% at some point of the pandemic. And this is something related to a high prevalence, again, of diabetes, obesity, and hypertension. When we analyze specifically the liver conditions associated and patients with the previous liver damage, we found that also the percentage of patients that require ICU, mechanical ventilation, and mortality rate was higher. Maybe something related to liver conditions or pre-existing or associated conditions to liver metabolic disease. Sure, hypertension and obesity is high prevalence here in Mexico. Also, and it's important to make this point as a difference, we have a high number of patients that take drugs that were not approved to treat COVID-19. For example, ivermectin and hydroxychloroquine at some point of the disease. There was a non-regulated prescriptions that we are pretty sure that we have a high also incidence of drug-induced liver injury.
So now that you bring up all those medications that were used off-label, can you comment a little bit about, was there any increased incidence of drug-induced liver injury in patients who were treated for COVID, in Mexico compared to what you had in the US? Is there any difference?
Well, we don't have the exact data already, but we are working on that. We are working in some prospective cohorts in Mexico, and the rest of Latin America, Argentina, Chile, and Spain. And we start to find some preliminary data that, for example, ivermectin and hydroxychloroquine has associated with a more severe disease. We don't know exactly if this is something that is an non-statistical association or just causation, but there is something there that we need to go further in our
finally, you mentioned in your paper a little bit more about patients who have an elevated FIB-4 score. Were their mortality higher compared to someone who actually came in with early stages of fibrosis in patients who had, for example, fatty liver?
Yeah, this is in some of the studies that has been just focused on patients with advanced liver disease, and mortality is statistically higher than those patients that have mild or disease in the first stage of fibrosis or metabolic conditions.
And finally, can you comment, is there any difference? I mean, we're seeing different data from Asia, North America, Europe. Is there any difference in what Mexico is experiencing with COVID compared to the rest of the world?
I think that we are very similar to the rest of Latin America. We have some data that we have compared with Chile and Argentina, for example, and the metabolic conditions and the liver conditions are quite similar. But yes, we have some differences with Asia, with Europe, and again, obesity and diabetes, it seems the most common conditions that we share as Hispanics, as Latin America. We have these risk factors that are quite different to the rest of the world.
So finally, Chema, anything that you want to comment about your paper? Do you want to kind of put some words out there as like, what is the importance of COVID and or the impact of COVID that had Mexico in the last, I would say, year and a half?
Well, as in other parts of the world, the COVID-19 pandemic has changed everything, has changed the way that doctors and patients are taking care of the health. We are pretty worried about the side effects of the pandemic. For example, we are having now a really rise in patients with cancer that has been not taken care of because of the pandemic. And we are worried specifically in the hepatocarcinoma. The patients that were standby almost a year and a half, we are having a really increase of all these conditions that previous to the pandemic, maybe we can pick it up in early stage. So we are expecting to have a rise and an increase in advanced hepatocarcinoma in our Mexican patients, for example.
Well, I mean, that's pretty useful. I mean, it's very interesting to see what other parts of the world are how other parts of the world are dealing with COVID, and specifically that we are having similar outcomes. And again, I do really want to thank you for your contributions. I hope we hear from you, and then hope in Mexico everyone is safe. And thanks for joining Clinical Liver Disease.
Thanks so much again to Clinical Liver Disease and all this initiative to involve the rest of the world, and especially to you as an associate editor. Alan, thank you so much.
Thank you, Tim. Have a good day.